This week I have a question from Lori, and it says, how do you handle it when patients say they can't afford the treatment that has been presented to them? Hi, I'm Janice Jansen from Global Team Solutions. We work with dentists and their team to create an organized, business-focused, yet fun environment. I'm happy to bring you some tips on how you can handle those patients that say they can't afford their treatment plan. Of course, we're always going to have some patients that can't afford their treatment plan, and that's inevitable, right? But I find a lot of offices, a lot of teams that assume that their patients can't afford the treatment, and therefore they either give them a lesser treatment plan or they tell them that they need the treatment, but they're like, oh yeah, we understand that you can't afford it. I think those are the things that we need to take out of our vocabulary and really just give them the facts of what they need. I say all the time, if I went into the doctor and they told me that I had diabetes or that I had heart disease, they're not going to be concerned so much on whether I can afford the treatment plan that they're giving me. They're telling me what's wrong with my health and what I can do to fix it. And that is our role in the dental office. What do they have that's going on, and how can you help them fix it? From there, that's where the education comes in to play. We really need to educate our patients on what their disease is or what problem it is that they are having with their tooth and how we're going to help them. But then also, what's going to happen if they don't end up getting the treatment that we have suggested to them? Make sure you're always giving them different options. If there's a missing tooth, that could be an implant, a bridge, a partial. Always give them different options, but make sure that they understand what's going to happen if that missing tooth doesn't get replaced, or if that root canal doesn't get done, or their periodontal disease isn't treated. That education part of it needs to come from the clinical team. If the clinical team can make sure that the patient understands their treatment, then when the patient comes to the admin team or the financial coordinator, from there, then it's, how can I make it happen? How can I get this treatment done? One of the things that needs to be done is have some different financial options available. It's tough for some people to just pay cash, even if it's by check or what have you. You always want to be offering credit card options. Care Credit is also an option, or Lending Club is out there. Have different options that your patients can use so that they can see what they can do to make this treatment work for them and get the treatment done. You can also do some prepay payments where the patient pays $200 for the next 3 months, or depending on what the treatment is that they need. If it's a root canal, probably not. But you can always offer that prepayment option, and they can build up some money in their account that way. It was great talking to you today. Again, I'm Janice Jansen. If you guys have any questions for us, please send them over to us. We would be happy to answer them and have them on our Ask GTS page. Our email address is info@gtsgurus.com, and our website is gtsgurus.com. We look forward to hearing from you.